Okay, welcome everyone to our July webinar. This week, as you can see, we have a lot of amazing speakers with us here today. Just a couple of housekeeping details before we start. If this is your first time on one of our webinars, the presentation slides as well as a recording of the webinar will be made available on our website tomorrow, and a follow-up email is going to go out with that with everyone, so don't worry about the slides. As we're going through the discussion, today it's an hour and a half, please feel free to use the chat function at any point if you have any thoughts, comments that you want to share with our wonderful speakers. And with that, I'm going to hand it over to our director, Maria, who's going to say a couple of words about our webinar today.
Good afternoon, everyone. It's wonderful to see so many of you attending this webinar at the height of summer. I think for many of us, this is a very different summer, which is partly why we are doing this webinar. For the last 3 months, we've really been hearing a lot from grade 12 students and from those of you working with grade 12 students that this year, more than ever, the transition into post-secondary, be it college or university, is bringing with it a lot of unique issues, a lot of unique concerns due to COVID. And what we really thought it was important to do was bring together our friends, our partners, the experts at a number of our partner organizations to give you their thoughts, their feelings, what they're also hearing directly from students who were involved in a number of focus groups that led to the foundation for this webinar. We are so pleased to have the Children's Mental Health Ontario with us, Good to Talk with us, as well as here's all of our partners, School Mental Health Ontario, as well as the Ontario Centre for Excellence for Child and Youth Mental Health, as well as representatives that are working in these organizations, as well as at one of our colleges. So we've really brought together a fantastic panel, and just as Perlin has said, we are also going to archive this webinar and furthermore put together an in-depth information sheet that we think will be helpful to those of you working in the sector, as well as those of you that may have family members and who may themselves be transitioning into post-secondary. So with that, I am very pleased to pass it on to our panel and to let them share the wonderful information they have for you today. So
Thanks, Maria. And so now we're just going to let our webinar partners just introduce themselves. And Carrie, you're up.
Great, thanks so much, Perlin. Thanks, Maria. Hi, everyone. I'm Carrie Smuck. I'm the Director of Public Policy with Children's Mental Health Ontario. And here at CMHO, we're super pleased to partner with the Centre for Innovation in Campus Mental Health, the Ontario Centre of Excellence in Child and Youth Mental Health, School Mental Health Ontario, and Good to Talk for today's webinar. As you all know, it's about supporting students who are making that exciting yet challenging transition to post-secondary during the COVID-19 pandemic. At CMHO, our goal is to promote a coordinated, high-quality system of care that puts children and youth and families first. And together with our partners, like the ones today, we look at health and community issues, and we look to develop policy solutions affecting the child and youth mental health sector. We have nearly 100 accredited member organizations operating in communities across the province. And the mental health treatment and supports that we provide range everywhere from targeted prevention to short and long-term counseling and therapy, and intensive services such as live-in treatment. Our members, such as one of the panelists you'll be hearing today, it's Anuja from Strides in Toronto. They've been doing excellent work of providing supports to children, youth, and community, including providing resources and programs to support students. And we're just super pleased to be here and partner with all of you today, and just wanted to thank you for the opportunity to introduce ourselves.
Thank you, Carrie. And then now we're going to go over to Purnima. Would you like to say a couple of words about your organization?
Thanks very much, Perlin. Good afternoon, everyone. I hope you're having a great week so far. Our organization, for those who may not know, our center focuses on supporting evidence-based service delivery in Ontario's child and youth mental health sector and community-based sector. And so with the arrival of COVID, we were, like many of you on the line, sort of stuck to say, what do we need to do to best support service providers who are working in all kinds of sectors to support the mental health of children and youth. We were really fortunate to be able to partner very quickly with CMHO, CICMH, and School Mental Health Ontario, so our partners here today, along with To Talk, which we play a role in at our center around the support for evaluation and training. And so really excited to be able to come together and in various ways support the knowledge needs of folks working across sectors to support mental health, optimal mental health, even at this very, very difficult time. And so we're really pleased to be part of this session today and really excited to hear from the experts. So particularly young people who are actually living this transition that's going to be happening. This is probably the most unique grade 12 experience they had, and probably the most unique post-secondary transition that has happened in a very, very long time. So really eager to hear from all of you, and really happy to be able to support this webinar to take place today. So thanks very much, folks.
Thank you, Purnima. And Jessie from Good to Talk, would you like to say a couple of words?
Hi, everyone. This is Jessie from Good to Talk. Echoing everything that everyone said beforehand, we're super excited to be here. So for those of us who may not have heard of Good to Talk before, Good to Talk is basically a mental health support line. So you can either call in or you can give us a text, and you can connect with licensed professionals as well as crisis responders who can help you through a tough moment. And Good to Talk is available 24/7 every single day of the year. And we actually start working with students once you start transitioning into that post-secondary space. So once you've graduated, you're more than welcome to talk to Good to Talk about things that might be stressing you out. I know we're going to be getting into some of those today, but especially this year, it is a stressful time moving into post-secondary. It's a stressful time on its own without COVID happening. So we're definitely there for you to talk to and ask questions and learn a little bit more about how you can kind of ease that transition.
Thanks so much, Jessie. And Kathy, would you like to talk about SMHO?
Yeah, it's Kathy Short, Executive Director for School Mental Health Ontario. We're a provincial implementation support team working alongside the Ministry of Education to help school boards as they support student mental health. You might know that each of Ontario's 72 school boards has a mental health leader and a superintendent that has responsibility for mental health. And our job is to work with them and their leadership teams to build strategies related to mental health and addiction support. And we provide guidance. We have a provincial school mental health strategy that sort of provides a little bit of leadership, as well as resources, implementation coaching, and a community of practice. Today you're going to hear from Joyce, who's our youth engagement lead on the core School Mental Health Ontario team, and Dr. Deanna Swift, mental health leader and psych services manager from Kawartha Pine Ridge District School Board. And we're just so pleased to join you today to consider the needs of this special cohort of students. We want to do all we can to help to ensure a good handoff from K to 12 to the post-secondary destinations. As Purnima and others have said, it's going to be a very challenging time for this special cohort, and I think we might find that more and different support is required. So really looking forward to hearing the thinking and dialogue on today's webinar.
Thank you so much, Kathy. And with that, I'm just going to briefly show everyone the agenda for our webinar today. Well, we just had our introduction and opening remarks. And then next, we're going to hear a little bit about what are the grade 12 students telling us and setting the context for the webinar today. And then after that, we're going to hear from some amazing panelists from the K-12 sector, community-based mental health, and also a post-secondary campus on a variety of questions. And then finally, we're going to go into a moderated panel discussion and audience Q&A. And with that, I'm going to hand it over to our first speakers, Joyce and Emily.
Thanks, Perlin. So as Perlin just said, so my name is Joyce Aragon. I work with School Mental Health Ontario. Today I'm joined with by Emily Joshua. I'll just be talking about what happened in our consultation with grade 12 students and summarizing some of the major themes that emerged. Next slide, please. So after introductions, I'll be talking about the purpose of this consultation, what the students identified as their main priorities and concerns during this challenging time, and then also some of the ideas that the students had on how best to support them with both their academics and their mental health during this time, and then some take-home messages from the students to you folks in the audience. Next slide, please. So my name is Joyce Aragon. I'm the Student Engagement Portfolio Lead at School Mental Health Ontario, and it's a position I've had for about 2 years now. Previously worked in community spaces and with young newcomers. And I just want to start off by saying I really appreciate starting this webinar off with student voice. And I hope that we can continue to center their voices as we all plan this challenging transition time, this challenging handoff. And I'll pass it over to Emily for a quick intro.
Hi, everyone. I'm Emily Joshua. I'm currently based in Hamilton, and before joining School Mental Health Ontario, my background was studying public health and mental health and disability management. So now my role here is supporting Joyce with the student engagement portfolio and helping to coordinate some of our projects with the student team. So thank you everyone for having us today, and I will pass it back over to Joyce.
Thanks. I think the next slide, please. All right, so consulting with grade 12 students was really critical as we, as partners, all discussed kind of the best way to support this transition. And it was important to ensure that the supports that we're providing students through schools, agencies, adequately reflect the needs of this cohort. So when it came to our priorities here, it was first discover what kind of concerns the students had during this time. So what was top of mind, what was pressing at the moment, what was most challenging during this transition. Secondly, hearing from students about how better to support them during this time. So what can this network of folks, schools, campus, mental health agencies, all do to help improve this transition? And then lastly, also discussing what has been helpful so far. Have they seen during such a challenging time that has been helpful and supportive? And then brainstorming, because I think this time, although challenging, has opened up our minds to what is possible. So it was a really interesting opportunity to also hear from students some of their thinking on what this transition could look like. Next slide, please.
I'm just going to talk about some of the main concerns and priorities that students had, some of the themes that sort of stood out. So starting off with falling behind in classes, that was one of the worries there with having to do school completely online and completing their first semester and year online. It's a much different experience interacting with professors and classmates on a device rather than in a classroom setting. They found that there might be difficulties with focusing and the distractions would be heightened. So not having that engaging classroom setting is a little worrying for them. And also feeling that their last semester may have a ripple effect on those first year classes and possibly subsequent years. The fear there is that schools are over accepting and may make it more of a competitive environment later on. They're also worried that falling behind in these classes may be difficult for adequately completing the courses in the future, not having the full basis of knowledge that they need to go into these first year courses. So they're thinking that things may be a little more difficult there with catching up. Another theme that stood out with majority of the students was the financial stresses. So during this COVID time, a lot of families and students themselves have been impacted by financial issues, and they're worried especially about paying tuition fees. While many of the students are working 2 or 3 jobs, some of them frontline, they're able to save for school, but a lot of others said that for a number of reasons, they're having difficulties with finding work. So just the lack of job opportunities for students has made it a worrisome for how they're going to support themselves. Next slide, please. So just generally, the overall impact that the pandemic has already had, starting off with the rites of passage. Students are missing out on those events related to important stages and transitions of their grade 12 year and first year, like graduation, prom, orientation week. They haven't been able to celebrate these stages in ways that they normally would be able to. A lot of students are also deciding to take victory laps, returning for school for an extra term or year to either save for funds or to attend post-secondary when things get back to normal, and the cost of learning when it feels more appropriate. For some of them, it's difficult to justify paying for a year that's only going to be online, not having that full experience. With the reliance on devices, connecting with friends and family socially, it's all been online. So returning to a physical school is nerve-wracking for them when that has to occur. They've gotten used to not seeing their friends, and many of them don't want to risk it. So that socialized fear of not being around other people due to COVID, they're wondering how that transition back to normal will be for them. And there's been increased anxiety and worry just in general around like all the uncertainty of COVID, and I think we all feel that as well. So with that being said, with these main concerns and priorities, I'll have Joyce talk about how students think that maybe we can support them at this time. Next slide, please.
Thanks, Emily. So we did talk about what are all the challenges, but then thinking, okay, what's helpful here? Let's think about some of the positives as well, or what some of the possibilities are. One asked what would be helpful during this transition. The main ideas that came up were how to make connections in new ways, and then also transparency. So when it came to making connections, we had ideas brainstorming about what could be possible here, what opportunities do we have? And some of the items that popped up were, what about youth-led mentorships? It was very daunting entering a new school, a new environment, a new way of learning. Wouldn't it be great if we could hear from those more seasoned students who have been there, done that, and can give them kind of the lowdown on how things will be in their first, or some things to get excited about when going to school physically is possible, and they can see their campus and things like that. That might be able to reduce their worry heading into their first year. Also, are there opportunities for virtual meetings for certain clubs like intramural sports, items where we don't need students to apply or try out for? Are there still ways that you can make those connections virtually and getting to know the people who hopefully you'll be able to meet in person and do things normally again at some point? Also, some anecdotes from the consultation when thinking about engaging in online school events for orientation week. Some students shared that their own schools or board had offered kind of virtual proms and virtual kind of send-offs, where whether it was a scavenger hunt, that they played an Instagram Live and got to run around their homes and finding things that related to their school in some way. But just that connecting, even though they weren't together, was really interesting. And so some students thought, ooh, wouldn't that be amazing for our Frosh Week, in a way to get to know our school in this way. As well as the last point, just connecting students in similar programs possibly. So again, using online platforms like Zoom or Discord to allow them to connect and build study groups as they learn online. So to Emily's earlier point, online learning has its challenges for a lot of students, the best of students. Usually when it comes to school, in post-secondary, you find those partners, you pair up with folks, you learn from other people. You have those tutorials, for example. So can that still happen virtually? Can we make those connections more explicit? And then moving on to transparency, the students there, when it came to how to kind of support their mental health and support their academics in this new stage in their lives, their thoughts were, because there's so much out there, there's so much uncertainty, and they're all online trying to find the answers. It's a bit daunting. They may be used to their own, secondary school platforms, and are now entering this the new stage. It would be helpful possibly for mental health supports that are available on campuses to reach out directly to students, to share what's available, and probably take guesswork out of that search. So rather than students needing to navigate these websites for help, reach out from those service providers would be helpful. And it also, in a way, opens up the lines of communication for those students as well. So helping out with the how accessible services are. That was an idea. And as well, to connecting professors and folks in academics, a similar sort of way of just being transparent about what is available, how best to connect during this time would be helpful as well. And next slide. So some take homes from the students were just an acknowledgement for folks to keep in mind that there are gaps in knowledge and there are missed rites of passage, and in those, and as unfortunate as they are, in those challenges, there are opportunities to adapt and possibly reimagine the way that we work usually. So there's a flip side to this challenge. Another note is that we may have more grade 12s taking victory laps or gap years. So this that we see in this next cohort for post-secondary, we might see some other older students coming in future years or future semesters. Online learning can be challenging, as we've said a few times, especially for these first-time post-secondary students. And now more than ever, clear and accessible mental health and academic support is needed. But then lastly, overall, the students were really excited to get back into some sort of routine. They are looking forward to school, things that I never thought I'd hear them say. Myself, I have an 18-year-old brother who's in this cohort as well, and this is the longest summer of his life. So he cannot wait to get back to some sort of normal, some sort of routine. So they're still excited there. I think they're excited to see kind of what this will look like. It's an interesting time for everyone. And then I'll leave with just highlighting that within School Mental Health Ontario, we do have resources, and Deanna will be sharing some ideas around that. We do have some resources that may be helpful to folks in this next stage in their academic careers. So I would recommend you looking at our School Mental Health Ontario website. We do have a partner hub called the COVID-19 Hub on jack.org/COVID for some resources about mental health support, self-care, reaching out for young folks as well. And last slide. And that's all, everyone. So thank you so much for taking the time to listen to what our students are saying to start us off for this webinar. I appreciate it. Thanks.
Thank you so much, Joyce and Emily. That was really great, helping us to see what students are kind of looking for at this stage. And now we're going to go over to Jessie.
Hi, everyone. This is Jessie from Good to Talk again. So one of the partners that Good to Talk has is Kids Help Phone. And we've been monitoring a lot of the data and a lot of the calls that we've been getting since COVID has started. So these are some of the things that we've been seeing. 54% more people have reached out to Kids Help Phone during this time than we would regularly see. And of course, that's because there are a lot of issues that are coming up. As you can see, the top issues, eating and body image. I know being at home can be really stressful, and a lot of people have different relationships with food, and that's coming up a lot. Grief and isolation. As we said, a lot of people have been concerned about not being able to see friends. With COVID happening, there is a loss. One, you can experience loss through losing someone that you know, but also experience grief and experiencing loss of the rituals that you would be going through. For a lot of grade 12 students, missing out on prom, missing out on graduation, and in the upcoming time as well, missing out on frosh weeks and stuff like that. It is sad, and it does bring up those feelings of grief. So know that if you are feeling that way, you're not alone. A lot of people are going through this, and it is a very stressful time. I guess one of the good things is that calls about bullying have gone down 14%. But overall, what we're seeing through this data is the issues that are coming up are no different than things we were feeling before, but they're just exasperated. They're affecting us a little bit more because now we're in a constant state of stress. And there's this term called collective trauma. Is basically when a community or a group, and in this case, the whole wide world, is experiencing something that is very stressful and very traumatic at the same time. And so that does cause us to struggle a little more sometimes. And at the end of the day, it's really okay if you aren't feeling well. It's okay to look towards different sources of support, and Kids Help Phone Good to Talk is one of them. So we will be sharing our phone numbers and our texting lines. So we're available through phone and text, as I mentioned before. And you can reach out and really talk at any time of day about anything that's going on. I think the biggest thing is recognizing that no problem is too big or too small, whether it is during this time or in the future when you are doing the transition, or even as you go into post-secondary. We all struggle sometimes, and that's okay. And so these supports are here for you to reach out to. Thanks so much, Perlin.
Jessie, Good to Talk and Kids Help Phone is really such a great resource for everyone. Okay, and with that, we're going to go into our panelist portion. We have some really great speakers from K-12, the community, mental health, and also the post-secondary sector. And they're each going to talk a little bit about how their respective organizations are helping students prepare for the transition. And our first panelist is Deanna. I'm going to hand it off to you.
Thank you so much, Perlin. Good afternoon. I'm Deanna Swift, and I'm the Executive Officer of Mental Health Services at the Kawartha Pine Ridge District School Board. So that means I oversee our professional staff working to provide mental health services for our students K-12, and as well as overseeing the mental health strategy for our school board. So next slide. So I thought this afternoon I would share with you just a little bit of a snapshot of what school boards have been doing to support mental health, recognizing that some of you may not be aware of the types of mental health services that are available in schools, and give you a little sort of snapshot of how we've been supporting the mental health of our grade 12 students in the past few months. So just to give you a little bit of background, Kawartha Pine Ridge is a sort of a medium-sized school board. We have about 33,000 students, 21 mental health clinicians who are registered social workers or psychotherapists, and 10 psychology staff. Our mental health services really are in 3 tiers, looking at mental health promotion and prevention for all students. So this is a really important part of our work in school boards, and it's really to think about the mental wellness of all of our students, including our high school and grade 12 students. And a lot of work is done throughout the year to make sure that our students are connected to resources, they know what's available in the pathway for help, that hopefully schools are mindful and have a strategy to be promoting wellness on a regular basis. So this might look like Wellness Wednesdays and special activities that are happening in the high school to help students learn how to manage their stress, build resiliency skills, and know about the resources that are available to them. So that's a really important part of this work. And I want to emphasize that because I think about, as we think about this cohort and their mental health needs as they're going into university and post-secondary colleges, even to the world of work, is that the kids that might be on our radar are the ones that may be at risk already and asking for help. And I wanted to step back and think about what the mental health needs are of all the students who are going to be entering into post-secondary, and ways in which that we could think about promoting their mental health and wellness, helping them build those strategies for self-care, resilience, coping with stress, because I think they will have a lot of stress, as most students do when they're starting a new adventure in life. So that'll be an important part to think about. And as Joyce mentioned, there's some really fabulous resources that School Mental Health Ontario has developed. One being Self-Care 101, which is a wonderful student, I think, co-developed resource with student voice, talking to other students about what they can do to take care of their mental health. So I think some of these resources, and you'll find them also on the jack.org hub, the COVID hub, would be really relevant to the kids going into post-secondary and really relevant for that age group. Reaching Out is another great resource developed by School Mental Health Ontario and our student leaders there. And talking about, how do I recognize when I might be having a mental health problem, and what are ways that I can talk to someone and reach out for help. Sometimes our students need the words, they need to know how to recognize and how to support one another. So that's a really, really important part. So with that, I thought I would give you just a little bit of a snapshot of the types of mental health services that we're providing in school boards. And they may vary from school board to school board, but I'll talk about ours at Kawartha. So we offer individual and group psychotherapy, cognitive behavior therapy, the short-term solution-focused BRISC model. School Mental Health Ontario has offered a lot of training around mental health for our mental health workers. So we're really shoring up those skills and really looking at evidence-based models for treatments. That's important to recognize. We also offer crisis intervention and safety planning for our students. This has been a focus as well during COVID to make sure that our students who are at home are safe. I think it's a particularly more difficult challenge when we don't have students in front of us to be noticing when they might be having struggles and difficulties. So wellness checks and check-ins and having a clear pathway where students know to go and ask for help when they need it will be really important for our planning. Okay, next slide, please. So this slide was just to remind us that we all had to do a pretty quick pivot come March, following the March break. Because all of a sudden we got notification that we weren't going back into schools, that we were going to have distance learning. And that really changed a lot of the ways that we worked, because we were used to working face-to-face with students. And this will be a challenge for all of us come fall again, particularly for students who are learning online. So just to let you know, in the first couple of weeks, we did wellness check-ins for all the students on our caseload and did some safety planning following March break. Our staff worked very tirelessly, adapting their services, adapting their CBT forms, putting things online, figuring out how to send off electronic reports so that we could keep students and services going in a virtual kind of way. So that was all new and very quick learning for us. But I think I'm here to say that it's very doable, and the services are as important and vital for our students virtually, and that engagement and being able to converse with students sort of face-to-face, even though it's virtually, is so important. So we continued to offer individual counseling. We started up 2 new CBT groups online, which was very successful. So thinking about what kind of mental health supports campus agencies are available to provide, it really did bring students together in a way where they were peer supported and breaks down barriers of putting students in groups across schools because of course it's virtual. So that was really good learning for us. We continued to do case conferences and meetings as we needed to online. And my last point there is we're continuing to provide virtual mental health services over the summer with the generosity of the government in offering some mental health resources to provide some continuity of care over the summer. And I'm going to talk a little bit about that with you as well, so you can sort of see what we're offering this summer. Next slide, please. This is a snapshot of our just grade 12 referrals for the school board during this school year. And from September to March, we served 1,400 students. And during COVID, we served another 281 new referrals, including the students we already had on caseload. So just looking at our grade 12 students, from September to March, we had 179 referrals, which accounted for 12% of our referrals. And then from March to June, we had an additional 63 referrals. So that put us up to about 22% of our referrals being grade 12 students. So that speaks volumes in terms of just the number of grade 12 students who felt they would be benefiting from some mental health services. Next slide, please. So just to put that in a little bit of perspective, of those 63 new referrals in March, 40 received direct counseling. 11 were referrals for attendance and counseling. So these might be students that were disengaged. So that's important to keep in mind. Disengagement is a really big flag for us in terms of how students are doing and how engaged they are with their learning and being able to access support and connect with the school. 9 were case management. So our students are very well served by our community partners as well. And sometimes it's just connecting that back to school and how they may be needing that transition to school and the skills that they're learning in counseling. And 3 were crisis intervention. So something important to notice, I think, for us as a school board, and something to keep in mind, is that I think in terms of overall our crisis intervention calls went down, as did our CAS reports go down. And a lot of that we feel is because educators might not have had as much direct daily contact with students, and there weren't enough people around them to sort of flag them to our services, or they may seek services outside of the community because they weren't coming to school every day. So something important to think about, because I think that engagement is huge in terms of the pathway and students accessing support. The last part of that slide just tells us that the number of sessions provided in direct counseling for those 63 students was about 7.9 sessions for each student. Next slide, please. And this chart just tells us a little bit about what the presenting issues were for our grade 12 students who were in service this year. Some of our students would have had more than one presenting issue. But the chart just shows us that really anxiety was the prevalent issue for being referred. That could also include anxiety about school and learning and the transition for next year. Mood symptoms was also prevalent, as well as family conflict, and grief was another big category. So some of these issues I think students will continue to face as they start their new journey in post-secondary. Family conflict and grief will be ongoing for those students who may continue to live at home. So we want to think about, you know, as maybe some of the family situations that students are struggling with, and that will continue as they're living at home and, you know, continuing their virtual or starting the new virtual online learning. So there's some of those concerns and those stressors whereas normal times they may be moving away from home and being on their own and having different challenges. Some of them may persist if there's family issues or conflicts going on, so that's something for us to keep in mind. Next slide, please. This slide is just a summary of some of the mental health services that we're offering this summer. We have about 250 students in mental health service this summer. We have 2 virtual cognitive behavior therapy groups going, 2 for elementary, 2 for secondary, which are important, focused on anxiety symptoms and management. We, of course, have individual counseling. Currently, we have 18 grade 12 students in individual counseling over the summer. Some of the other services we're offering is parent consultation and coaching, and that's really to support parents of some high needs special education students at home and how they're managing. We have a summer mindfulness camp going for some of our younger kids. And the last service I wanted to sort of highlight for you, and this is a program, a psychoeducational program for our grade 8 students entering grade 9. So they're in grade 9 summer school doing a credit ahead of high school. And we really focused on 4 sessions for all of these students, not just targeted students, but thought it would be good for all to really help them understand what supports are available in high school. So what their academic supports will look like, helping them understand their learning styles, how to best learn online when they're in summer school, how to understand their mental health and how it might impact their learning and their motivation to keep engaged with school, how to access and advocate for supports for mental health and as well as for learning, and students who are struggling with either the online format of learning or learning disabilities, and then bringing it all together and having the students have some self-awareness and develop their own learning and coping plan for their own mental health and learning needs. So I thought this was important to highlight because it may be something to think about in post-secondary, where you may be able to reach out to some of the new students coming in and helping them understand what their learning needs might be, helping them understand best ways to study and engage in learning when it's online, and having them have an introduction to mental health services, how to ask for mental health services, and how to advocate and get the supports that they need, and first to be aware of what's available. Next slide, please. So to sum it all up, we really heard from our student leaders in the past that they need to know what's available. And we want to be, I think, mindful that not only do we want students to know when they need the help, but we want all students to know what's available before they're in a crisis, or before it comes to the point where they are not well enough to access what they need or don't have the energy to access what they need or feeling overwhelmed. So good, our students are letting us know, and even our high school students sometimes let us know that they don't really know what's available within the building of the high school if they haven't accessed mental health supports before. One of the projects I worked on with our student leaders last year was that our students had questions about what mental health workers do. So what do our social workers do? What do our psychologists do when they work with students? I think they may have the same questions about campus supports and mental health supports. So one of the things that we were able to do with our students was make videos where they interviewed our mental health support workers to find out exactly how they help students, what their qualifications are, what they might expect if they engaged in a mental health session with a professional. And that's really helped the students' knowledge and awareness of what was available, maybe made it seem less scary, but gave them the information that they needed just in case they needed it. And this information was good for all kids, not just our kids that we might consider at risk. The other thing we really want to focus on within our schools, which is also applicable, is for students to know how to help a friend if they're in crisis or if they themselves are in crisis, and when to reach out and where to reach out and call. So that's important. And the Good to Talk resource is excellent, which will be really good, just like Kids Helpline, to know them, let them know that's available, but also what campus supports or community supports are available as well. We know that in our learning that caring adults makes a huge difference, and those social connections make a huge difference in supporting mental health. So as Joyce talked about, the students are really looking for a way to connect and make those supports online. Caring adults make a huge difference in our school in terms of watching out for kids and getting them to the right help. So that would be a key consideration going forward. We learned certainly that virtual contact can be as effective as delivering services in person. So it's about maintaining the engagement and keeping kids engaged. And then finally, a good learning for us is that multidisciplinary approach with community collaboration is really key. So using our partners, our mental health, children's mental health agency partners, working with our mental health and addictions nurses, working even across school boards and across disciplines is such an important key consideration. So as we think about this whole community need and we think about post-secondary, as well as our community partners, really think about how you can work together to support those students who may still be in their home community, but attending an institution not in their hometown. So thank you. I look forward to the panel discussions.
Thank you so much for that, Deanna. And now we're going to go to Anuja.
Hi there. My name is Anuja, and I am an individual and family therapist in the day treatment program at Strides Toronto. So today I will be speaking about community counseling and some programs offered by our agency, which helps students transition to post-secondary school, and also some programs that might be helpful to students transitioning during this pandemic. So Strides Toronto is a new multi-service agency providing services to young people from birth to age 29 and their families in East Toronto. It was formed in January 2020 through the amalgamation of Aisling Discoveries and East Metro Youth Services. Strides Toronto provides a range of community and residential treatment services to improve the mental, social, physical health of infants, children, youth, and their families. So we provide individual, group, family interventions that include mental health counseling, autism services, education, outreach and referral, early intervention, day treatment, and community support. Can we go to the next slide, please? So due to Strides Toronto being composed of two agencies, I will speak about each agency as well. So East Metro Youth Services is an accredited multi-service mental health center that has been serving youth aged 12 to 29 and their families in East Toronto since 1974. And in 2015, East Metro Youth Services was named lead agency for Toronto by the Ministry of Children and Youth Services as part of the province's mental health strategy. Next slide, please. And the second agency that's part of Strides Toronto is Aisling Discoveries. So this is another accredited agency by the Canadian Centre for Accreditation. Services are for children from prenatal to 12 years of age who have or are at a risk of developing social, emotional, or behavioral problems, and for children and youth up to the age of 18 who are on the autism spectrum. And next slide, please. So as a lead agency for infant, children, and youth mental health in Toronto, Strides Toronto works with 31 core service providers to design and implement system-level improvements that transform access to services, experience of services, and the mental health outcomes for Toronto's diverse communities. So Strides Toronto has more than 350 employees providing services in East Toronto currently. Next slide, please. So here you will see some of the various programs that we do offer. So the programs I will specifically be talking about today are Priority Access in Schools, Day Treatment, our Walk-in Clinic program, Mental Health Toronto, Newcomer Youth Program, and Youth in Transition program. So as you can see here, we offer various programs in autism services, childcare consultation, community counseling, East Crew Group, Gallery Respite program. Next slide, please. And another bunch of other programs as well that we currently do offer. Next slide. Thank you. So the first program that I wanted to speak about in depth is our What's Up Walk-in Clinic. So just like we have walk-in clinics for our physical health, What's Up Walk-in Clinic is a walk-in clinic for mental health. So the What's Up Walk-in Clinic is Toronto's only free 5-day-a-week mental health counseling walk-in service for children, youth, young adults, and families. There is no appointment necessary. So the clinic helps with issues such as depression, anxiety, self-harm, suicidal ideation, sexual identity matters, bullying, behavioral concerns, addictions, and anything else that might be on one's mind in that particular moment. So all the information that is discussed is, of course, always confidential. And as you can see here, I put down some of the locations that it's offered in. So we have 6 locations. So it's offered at Skylark, Yorktown Family Services, YouthLink, Griffin Center, Mental Health. And on the following slide, you will see that the other 2 locations that we do offer it at as well. So currently all services for the What's Up Walk-in Clinic are being provided through the telephone. Next slide, please. So at the What's Up Walk-in Clinic, therapists offer single sessions, so up to an hour long, and therapist works to support clients with their concerns and work collaboratively with the client. So the focus is on abilities, resources, and skills that you have or you would like to develop, and together the session is used to target a priority concern and develop a plan with the client so that they feel comfortable with the solution. So if a client feels they need more help, they can always call back to be connected to the What's Up Walk-in Clinic, and all our therapists are clinically trained. The clinic is a low barrier and meant to be easily accessible. So there is no health card that is even necessary. Everything is completely free, and it was created to help with the wait times in the emergency rooms of hospitals. So currently all sessions are being continued via telephone, and sessions are offered in 10 different languages and at 6 locations, Mondays through Fridays, 9 a.m. to 7 p.m. And those are the other 2 locations that we do have them at as well, the Etobicoke Children's Center and East Metro Youth Services. Next slide, please. So the second program that I did want to talk about at Strides Toronto through community counseling is the Priority Access for Students program. So this is a program that provides individual family counseling services as well as case management for Toronto District School Board and the Toronto Catholic District School Board students and their families. So students are identified and those who need support are referred by the school social workers to this program. So the goal of Priority Access in schools is to prepare the youth to function independently and effectively within the school environment, the greater community, and the home. So we also work to prevent youth from needing more intensive services such as residential treatment in the future or day treatment. Trained clinicians provide individual family therapy once a week or even up to 2 times a week if needed, and this is a time-limited service, so usually clients are in this program for 3 to 6 months. Next slide, please. And the next program I'm talking about is the day treatment program. So this is a program where I am a therapist at. So the day treatment program is a school-based program, and it provides an educational setting combined with therapy that helps young people to deal with a variety of problems and helps them to return to the school system or enter even the workforce. So the student schedule includes 3 academic periods, 1 period of therapy, including adolescent life skills and dialectical behavioral therapy. The focus on therapy allows the youth to explore personal areas of strength and focus on development skills in the areas of mood regulation, anger management, communication skills, relationship building, self-esteem, self-awareness, responsibility, stress management, substance abuse, and problem solving. So youth take part in planning their own program and future goals. So each classroom is staffed with a East Metro child and youth worker, a Toronto District School Board teacher, a individual family therapist is also assigned to the young person and their family to help navigate day treatment services and also provide ongoing individual and family therapy. So on average, students remain in our program for a year, but some stay for 1 semester and others can stay for longer. The program is individualized and length of stay is discussed and agreed upon with the client and family and the treatment team. So currently we have 5 day treatment programs. So in the high school setting, we have 2 programs at Cedarbrae Collegiate and 1 program at Winston Churchill Collegiate. And We have one in a elementary setting, so in grades 7 and 8 at Charles Gordon Senior Public School. We also offer a youth and justice day treatment program. So that's another interesting part of this program as well. And during the pandemic, we continued classes, our DBT groups and therapy all online. Each child had their own personalized schedules to accommodate for during the pandemic, and each child had the opportunity to connect with their therapist, their child and youth worker, and their Toronto District School Board teacher. We made sure to connect with parents as well on a weekly basis to get feedback on how the child was holding up during the switch to distance learning. And all children enrolled in our classes attended therapy throughout this period via video. We had minimal disengagement, which was a really big success for us in this program. The next slide, please. The next program I'm talking about is the Newcomer Youth. So the Newcomer Youth program is for youth aged 12 to 21 who are immigrants to Canada and are permanent residents or conventional refugees. The program provides free activities every month that include volunteer opportunities, sporting events, workshops, and trips around Toronto. So this is a really great program for youth and young adults to kind of feel more involved in the community, especially when they're new to the country, and make friendships. And the workshops and events during the pandemic were all held online virtually. So a calendar is usually released to the kids via email and our social media pages. And so the children can follow each of these workshops and enroll in them. Next slide, please. So this program is the Youth in Transition program. So the Youth in Transition program helps support youth transitioning from the child welfare sector into adulthood. So to be eligible, youth must be between ages 16 and 24 years old and a child in extended society care. So some resources and supports may include housing or educational supports, employment, service trainings, life skills training, so help with financial management, household management, legal services, and health and mental health services. So youth receive other supports including snacks, CTC fare to help them go to interviews, job fairs, or house hunting. Our youth in transition workers meet youth where it's most convenient for them. So that could be in the community, such as in a coffee shop, library, or at the office. And the length that we work with the youth in this program varies based on their long-term, short-term goals. And referrals can be made by the children's aid service workers, school, families, other service providers, or the youth can also refer themselves as well to this program. Next slide, please. And the last program that I did want to talk about is Mental Health Toronto, so MHTO, also known as. So this is a really good resource to help navigate community counseling. So navigating the various community counseling services can be very daunting, just because there's just so many community counseling agencies, just as us. So Mental Health Toronto is Toronto's central access point for infants, children, youth, and their families to mental health and addiction services in our community. So their goal is to help those in need find and get mental health as efficiently and as quickly as possible. So by pointing the client to the right program or agency based on their immediate need. So MHTO can also connect you to a phone or video counseling session with the What's Up Walking Clinic network, and service providers and any other support service can call MHTO as well for various information, and but they will need the express consent of the person or parent if you would like to refer them to a service. And that's all for me. So I hope this was helpful, and thank you for listening.
Thanks, Anuja. And now we're going to go to Maheen.
Thank you, Perline and Maria, and for giving me the opportunity to speak today. I'm a counselor myself at Sheridan College, and I'm also the chair of Ontario College Counselors. Ontario College Counselor is a committee which represents all the counselors in 24 of Ontario colleges across Ontario. And it's a professional organization. The purpose is to promote high standards of ethics and practice in college counseling, and also to contribute to the professional development of our members and to facilitate effective working relationships among the OCC members and other organizations. Next slide, please. So today I wanted to talk about how difficult it has been with COVID, and as you heard from other panelists as well, having to very quickly pivot into this new way of being has been very anxiety provoking, has been very stressful for students, for faculty, and for staff. And the message I wanted to really focus on today was what is in your control and what is not. One of my favorite books of all times is, and if you get a chance over the summer to get one book on your reading list, it's Viktor Frankl's Man's Search of Meaning. And the main message in that book is when you're no longer able to change a situation, or when you're challenged by your situation, then you must change yourself. And I thought it was very befitting the current situation. We're all thrown into a situation where there's a lot that is not in our control. And we can take that control by changing ourselves and adapting ourselves to that situation. So on that note, I really like this image. What I do when I work with students myself, I help them focus on writing everything down that's in their control and what's not, and it helps to separate the two. Next slide, please. So currently, because of COVID, there's a lot of uncertainty, and it's creating a lot of anxiety. It's creating a lot of stress. We don't know how long the social distancing measures will last and what the future will be like after this. The fact that a lot of the learning will continue to happen remotely and missing out on Frosh Week in person after not being able to attend graduation and prom is very anxiety provoking and stressful. And so that is the stuff that can go. I worry that it happened from my end.
No, I think it was on our end, but no worries. We are back to, we're all back up.
Well, we're nothing if not adaptable, so this is good. All right, I'm happy to be back. So, Perlene, can we go to the next slide?
Sure.
All right, so going back to that circle of what's in our control, I want to talk more about navigating resources in the post-secondary education sector. How to maintain work-life balance in this new environment of remote learning, as some of the other panelists have talked about. This transition is already difficult to begin with, and when you throw in having to do it all remotely, it's challenging. So I'll talk a little bit about how to maintain that work-life balances, some of the healthy coping strategies, staying focused, and creating meaningful connections with your faculty and peers in a virtual learning environment, and how you can access mental health supports. Next slide, please. So when it comes to your academic coursework, if there are challenges or with the course content, if you have technological issues, the best thing is always to start with your faculty. All of the colleges and universities, they also have peer tutoring available, typically through the library, which are offered free or at a nominal cost. The library services are a huge resource for new students. They help students with, let's say, how to do citation, how to adapt to the new learning environment with different aspects of the technology you have to use. One of the most important services you can access is accessible learning. So this would be the equivalent of, let's say, having an IEP in the secondary school system. And sorry, can we go back? Yes, to this one, sorry. So accessible learning, and I'll talk about it in greater detail when we're at the Student Affairs Services. And during COVID, a lot of the colleges and universities will have COVID dedicated links and resources. If you go on the Ontario College Counselor's website, you will see a COVID dedicated page there as well with a lot of tips and resources. And I wasn't able to add a link here because there's 24 colleges and dozens of universities, but whichever university or college you're applying to, make sure you find that link, and that link will have a lot of information on how to access financial resources, academic resources, and supports such as mental health and accessible learning. Next slide, please. So these are some of the departments that are available at my college, and it would be the same structure pretty much across the board. Accessible learning would be, again, the equivalent of having accommodation. So if you have a disability, mental health or physical, which requires accommodation, the first step would be to connect with an accessible learning advisor. They will give you a medical form, which you will have completed by a healthcare practitioner or a family doctor, and that allows you to access the accommodation. So that means extra time to write exams, extra time to write assignments, having a quieter space during exam time. So that would be something to, over the summer, to look into. So you have all of that process set up. Student advisement is another area. If you have general questions about your specific academic program, you can start there, and they will guide you what kind of credits you need to take, what kind of electives you need to take, and generally give you an idea if you have a question about your timetable. We also have career counselors available. If a lot of time after first semester, a lot of students realize this is not the right program for me. I don't know what I want to choose. So they can really guide you in that direction and help you based on some of the assessments that they do, which general programs would be good for you, and they can support you in that process. Counseling, which I myself did at my college, is available to you free of charge, where you can come and talk to a counselor in a confidential space about any stressors you have. Our goal is to support you in being successful academically. And a lot of times there are roadblocks, such as issues with families or not having enough resources or depression, anxiety. So your counselor will help with you in a solution-focused model to support you in achieving those goals. One thing I really want to bring home here is the confidentiality of this service. The fact that you're accessing counselor as an adult means that nobody else has access to that information, that be it your parent, your neighbor, your faculty, your friends. Without your written permission, nobody would have access to that. Health services. So we typically across all the colleges and universities, there are physicians and nurses available, and if you need immunizations done or you feel unwell, they can support you over there. We also have great athletics programs. So currently during COVID, they're doing some virtual classes like Zoom and boot camp online. So make sure you check that out. It may not be the same as in person, but if you do it online, there's that available for you. Student rights and responsibilities. So this is a department that would overlook if there are any concerns of, let's say, harassment you're experiencing by your classmates. So this is a place where you could go and file a complaint. Tutoring, and that would be again available typically through the library, and in general basic courses like English and math, it's typically free, and some of the more specific courses would be available at a very nominal cost. Financial assistant would be the department such as financial aid office, where if you are an OSAP, which is Ontario Student Assistance Program, you could go and ask questions, apply for bursaries. There's a lot of financial support now available for COVID. So make sure you reach out to that as well. Center for Equity and Inclusion would take any concerns or complaints if you're experiencing any discrimination because of your race, your ethnicity, or your sexual orientation background. We also have a Center for Indigenous Learning, and a lot of universities and colleges have that, and they have support services available for students who identify as Indigenous. Every post-secondary institution would have an IT service office where you can connect with them remotely, typically from 8 in the morning till 10 at night, and get support if you're having any issues with your computer, and they can walk you through that step by step to problem solve it. And as I mentioned earlier, make sure this would be the best thing to get support from your library. It's a wealth of information that's available to you free of charge. If you're unfamiliar with how to do citations, for example, or how to create the right format for an essay, or how to do research on all the online databases, they will support you and guide you. And we also have a first-year librarian who's dedicated to supporting students in their first year to make that transition easier. Office of the Registrar would be if you have any questions about your transcripts or your enrollment, any issues with getting your timetable corrected, then that would be the place to go. Student Union would be comprised of your peers, of your older students who are elected, and they would run programs such as a food bank. They would also run a lot of student clubs. So make sure you check out your local student union wherever you're going and participate. Next slide, please. So these are some of the coping strategies I created for during this time when a lot of the coping strategies don't necessarily apply. You can't go and hang out with your friends or travel easily. So some of those restrictions make it hard. But to have that work-life balance where you're able to focus on your academics, be successful while also managing everything, all the stress that COVID is bringing, it's important to set some of these routines and having these strategies in place. So eating well-balanced meals, maintaining contact with friends and family, even if it's virtual, meditating. There are a lot of great apps out there. I highly recommend MindShift for that. It's free. It makes a big difference. Lighting a candle, writing something in your gratitude journal. So every day, if you start the day with writing 5 things you're grateful for, it will make such a big difference in how that day goes. Practicing deep breathing, and there are a lot of great free apps out there on how to manage your anxiety or your stress just by doing the simple art of deep breathing. Next slide, please. Listening to good music, increasing physical activity, and look for some of the resources and what's available at your college. So at my college, we do something called Mood Roots, which CICMH and CMH has supported us with, where you can now virtually walk with some of the other students on your campus. It's really also important to limit some of the upsetting media coverage. I know sometimes it's difficult, but not easy to know all of the daily death counts from COVID. So the more you limit it, the easier it can be for your own mental health. Practicing random acts of kindness goes a long way. And I think we've all witnessed that during COVID, how it's brought communities, it's brought everyone together to support one another. And that makes a big difference in our mental health. Spending time in nature, especially during the warmer months, that will go a long way. Taking candlelit baths, dancing, trying something new in the kitchen, or reading a good book. So those are all good ways to keeping your stress level and your anxiety level down. Next slide, please. So staying focused during remote learning. When everything is on the computer, there are a lot of distractions from different kind of apps, and it's hard to stay focused. So the best advice I give is to start with a daily planner. And that daily planner should include things like, what are some of the tasks I have to do today? Write them down, like 5 or 6 things. What is your goal for today? And what are some of the self-care activities you're going to try that day? Just a simple act of doing this for a few minutes, it takes maximum 5 minutes to do it, you will find that the rest of your day will be way more productive and way more planful. Next slide, please. So some of the things you can do during the summer before you start in September is organizing your learning and your living space, because the more clutter-free it is, the easier it is to stay focused. Setting a daily structure and routine, as I mentioned earlier, and familiarizing yourself with the resources at your respective post-secondary institution. Go online, and every institution has something on COVID-related resources. Get in touch with the student advisement, for example. Get in touch with the student affairs department. Ask them that you need to connect with resources, with a counselor, with accessible learning advisor. And if you do it over the summer, then come fall, it will make the transition much easier for you. Learning to say no is also a really important way to minimize what's on your to-do list. So to be focused and to stay productive, sometimes there will be things you'll have to say no to be more successful academically, right? Trying meditation helps us to improve our concentration level. And a lot of the institutions, a lot of the colleges are now offering virtual meditation. So make sure you find out what's available at your college or your university and enroll yourself in those programs. And set rewards for yourself when you accomplish your goals, and get physical exercise. So all of these strategies will help with your attention span and ability to stay focused. Next slide, please. Creating meaningful connections, especially while you're not able to attend in person, is challenging. So make sure you check out what is offered. Join a student club. Even if it's virtual, you'll be able to connect with your peers based on your interests. Participate in classroom discussions. Raise your hand, ask questions. There should be opportunities to volunteer or collect co-curricular record points. So these could be things like volunteer to writing notes for a classmate or attending Toastmasters. So these kind of activities will help you not to get some points, but they will also help you to be more engaged in your post-secondary education. Apply for on-campus jobs. Not only it's a great way of making money, but it's also a way to connect with other people, sometimes students who've been there a couple of years, and learning from them. And apply to become a peer mentor. Every department and most colleges would have this position, and a lot of the times it's paid. So this would be a great way to get some experience and be more engaged and develop connections at your college or university. Next slide, please. All right, so when it comes to our moods and our mental health, just remembering that emotions and moods can vary. This is the first time we're in that situation globally, where all of the learning, all of the interactions are happening virtually, right? So be kind and be gentle to yourself as your emotions vary. And remember, it's okay to ask for help. Even if your first time asking for help is not as you planned it to be, don't be shy. The best advice I can give is to be persistent in asking for support, and it will greatly improve your chances of succeeding and being well. Every university and college has some kind of on-campus counseling available, and most likely a lot of that will happen virtually, either video or by telephone, and some of the institutions are also offering it by text. And if you need counseling in after hours or on weekends, many of the universities and colleges also have a student assistance counseling programs, which is external to the counseling department at your college or university, but they will try to provide you with that service. after hours. And as I said before, a lot of the counseling is happening virtually, which is difficult because in person is really important. But until we can resume that, make sure that you reach out and get the support for you. And your counselor can also help you to connect you to other resources that you didn't know about. Managing your expectations, so that just means that it's important to know that change takes time. Unlearning habits takes time, learning new habits takes time. But if you're persistent and determined, you will see change when you engage with the mental health supports at your college or university. So that brings my presentation to an end. And if there are any questions, feel free to ask.
Thank you so much, Maheen, and thanks for that wonderful presentation. And now we're going to go into a little bit of a panel discussion. I know we're running a bit late because of the little technology kerfuffle we had earlier, but if everyone can stay for this little bit, that would be wonderful, but if not, understandable as well. So, oops, sorry, I'm just going to stop that share and come back to. Here we go. Okay. So I just wanted to kind of talk about some of the content we've been discussing in this panel. And one of the questions that I'd like to put to all of you is, because things are so uncertain and things are really subject to change, and students might not feel that they have the sense of stability in what's going to be happening come the fall, how can we best support them when things are so unclear? And just open it up to everyone if anyone wants to chime in with their thoughts.
This is Joyce. I just wanted to say some of what we heard from the students was about transparency. And although we don't have all the answers, sharing that, opening it up to discussion with students is helpful. And just engaging them in the conversation of what is certain and what is not, just to kick us off.
I agree with you, Joyce. I think it's important because we won't have all the answers, and also information changes rapidly and the circumstances are changing sometimes, right? Week by week. So even if there was a place online where each campus could, just set up frequent questions and answers and keep that up to date, maybe have it student monitored by some of your student leadership groups or unions and things like that for commonly asked questions. That would be a place where students could go and ask questions online and get the most up-to-date information.
I also think that, maybe universities should also reach out to the professors or the people that are leading the classes as well, and maybe even do check-ins with the students before classes or at the end of the class or something like that, just to make it more of a regular topic as well. Just check in with the students or just so that students don't feel disconnect from their lectures as well, because they're probably, thinking of going to be in person in class, and they've been thinking that from before when they were applying to university, and then the first year they're there and everything is virtual. And when a professor or teaching staff is also more relaxed in the sense that also checking in with the students, that might make the children as well, or the students, feel more welcoming. Because in our program, at the day treatment program, the students and the teachers have a really great relationship, and we've noticed the benefits in the children and the students' performance in their academics as well, and in therapy as well. So not only do they have to speak about mental health related things with a therapist or a clinician, but also that conversation is regularly being had or being brought up even in the classroom setting as well.
That's a great point. And actually, for those of you that are on the line, one of the things that we will be putting out, the center will be putting out in August, is actually a faculty toolkit that looks at how faculty can make mental health part of their curriculum. So it doesn't have to be the course content, but that doesn't mean that faculty can't play a huge part in student mental health.
Yeah, and I would echo what everyone else has said. And I know a lot of the colleges have done outreach campaigns during when COVID first happened to check in how students were doing and then connecting them to services. And I foresee a lot of that happening as the fall semester rolls around. A lot of our advisement staff would reach out to students, check in with them. We have peer mentors who do guided calls, scripted calls, to check in. And the feedback has been great that having someone make that personal call and checking up on students, especially who are struggling with depression or anxiety or COVID-related stress, it's hard to reach out. So that continues to be the focus and priority across the entire sector. And that way it's transparent and it's available. And I would encourage all the students to connect as well and reach out.
Great point. I really like what everyone's saying, especially around that transparency piece and just trying to communicate as much as possible to students. Now, Maheen, you talked a little bit about this in your presentation about how students can maintain a healthy work-life balance and kind of manage their academics as well as their home and their work life. Does anyone else have any thoughts about how, how do we help students, or how can we teach students to manage that balance?
I think it's also really important to kind of consider as well. Some kids are doing distance learning and they share a home with 2 other siblings, or they share a home with 2 parents that are working. So, and if everyone is also doing distance learning, it can make things a little bit difficult for the kids as well, and a little bit overwhelming in that sense as well. So I think it would be really good maybe if like, for example, at the What's Up Walking Clinic, a service that we provide, we do counseling not only for like youth, but we also do counseling for parents as well that don't know how to deal with their kids, or don't know how to motivate their children, or what they can do to kind of reinvigorate their kids as well. We've had a lot of parents that call in and kind of let us know about the situation as well. And their kids aren't willing to kind of go get services because, like he was saying, a lot of people have a hard time asking for help, but parents can see, my kid isn't really functioning the same way as they did before the pandemic. So the What's Up Walking Clinic is a really good way for parents to also gain support as well. So I think that's really important. Sometimes it's the family core unit that needs support, not just the one individual in a family. So I think it's a big priority to have as well.
Yes, I think that's really important, as well as I like how you pointed out some of the kind of equity-related concerns in that not all students are going to have the same kind of learning environment when they're at home. I'm wondering what thoughts everyone has about other similar equity-related concerns that we need to be thinking about. For example, international students who might not be in the same time zone, so synchronous learning is not going to be as accessible for them and things like that.
We actually have a great comment from Melissa, who has also let us know that students in post-secondary can actually book one-on-one with learning skills advisors, so they can get support to create a schedule, not just academic, but also time for wellness. So great tip from Melissa. Thank you.
Part of the challenge that we had with distance learning was really those equity issues around whether students had reliable Wi-Fi access, whether they had a computer at home that was designated just to them, or they were sharing again, as you said, with siblings and other parents who might be working from home as well. So important, I guess, as students are starting, that if part of the orientation package is to reach out to IT if they have any of those concerns, where they might be able to access free Wi-Fi, if I don't know if on-campus libraries will be available, whether it's the institution they're going to or whether it's in their own hometown because they're learning from home. Maybe there's another college or campus close by. So I think innovative things like that, where they might be able to access services that are close to them, and working with financial aid. So letting them know what's available so they can problem solve that, because that can become a barrier pretty quickly for them keeping up with their academics, as well as accessing any kind of virtual mental health support.
That's a really good point. Sorry, I just wanted to share very quickly that what happened at my institution, Sheridan, was the students who had those barriers, who didn't have a personal laptop, they were able to get one from our IT department. So it was, at our college, the priority was the staff was encouraged to use their own personal laptops, and all of that was, the priority was to give it out to students who didn't have that access. And again, so it goes back to, if, you know, students, if you're struggling with, you know, whether it's not having a laptop or any kind of computer, make sure that you let someone at your organization know. Reach out to IT, reach out to your faculty, reach out to an advisor, but do let someone know, take that initiative, and you will be able to get some help.
That's great, Maheen, thank you. And so I think maybe now we're running a little bit over, so maybe I think the last question that I'd like to put out to everyone is, you know, what is the best piece of advice or lessons learned that you can share about your work in helping students transition?
I would say reach out, let someone know that you're struggling. If you're having a hard time, because you're not the only one. A lot of times people, students, especially as a freshman, as a new student in a new environment, we think we're the only one struggling with this issue. We don't ask questions, we don't ask for help, and we suffer in silence. So it's really important to reach out to someone, whether it's your faculty member or the person calling you for an outreach campaign, that you ask for help and take risks in opening up. And that's the best advice I could give. Yeah.
I think transitions, no matter what age, are difficult. Whether you're transitioning from elementary to high school or high school to university or from university to the workforce, transitions will always be stressful due to change. And I think as humans, we having, even if you have the most greatest mental health, you're still going to be challenged during a moment where there's change. And what happened with us in the pandemic was there was a numerous amount of changes that had to be made. For a lot of people, they had to readjust. So I feel as though when you're going through a transition, the most important thing, like Maheen was saying, is stay connected, whether it's even with a friend or a family member or somebody. It doesn't have to just be a mental health professional, but stay connected with whoever, just so that you have somebody to check in with you, and you are checking in with somebody as well. And that goes for anybody. So if this is a very difficult time, and I'm sure we'll get through it, but in the meanwhile, make sure that you remain connected with whoever you can remain connected with, whether it's a service provider or a therapist or a friend.
I think those social supports are so important. So if there's a way, as we're introducing students to their new learning environment and their new campus, having ways where they can connect as a new group of students, whether some of them might be living on campus in residence and still going to school virtually, whether it's a study group, or having a mechanism or way to make sure that all students are connected to someone, and having that opportunity to make those connections and relationships will be really important. And hopefully they'll still reach out to their family and the supports in their home environment, which will be so important going forward. I think one of the other lessons learned is that, what is necessary for some students in terms of managing their stress, their well-being, their life-work balance, their own learning needs is good for all students. So is there a way to share this information, the great, slides that Maheen had, things from learning, student abilities or student services, and reaching out to new students starting these programs to better understand their own learning needs, whether they have a learning disability or not, understanding some self-care strategies, understanding what is available for them should they need the help, would be good information for all students, not just the ones that we feel might be at risk or might be needing a little bit more, so that when they do need them, they know what's available and they can practice some of those strategies up front.
I think that's a great point, everyone. So with that, I think that's where we're going to end today. Thank everyone for sharing your expertise in this webinar and being with us here. Maria, did you want to say anything in closing?
Just apologies for the technical glitch. I'm really sorry about that, but know that the entire hour and a half will be archived and sent out to all of the people that were registered, so including those that may not have rejoined after the blip. And thank you so much to the panelists. I know a lot of time and effort went into this, and for those of you watching, please know that we're also going to be creating a information booklet that can be shared with your students. So it'll be both frontline facing as well as student facing. And we thank you for spending this summer afternoon with us.
All right. Thank you so much, everyone. And yes, Maria mentioned the slides and the recording are going to be made available in a follow-up email. So stay tuned. Thank you so much, everyone, for joining.
Thank you.
Thank you.
Take care.
Bye, everyone.
And sorry to our panelists, I apologize. That has literally never happened. And of course, it's happened today. So yeah, I think that was just us testing your own resilience of coming back. Proving to our students that even in sort of the most stressful times, we can come back with a smile. So thank you so much. Really great information, and the comments have been fantastic. So thank you. I think we're going to you will make a difference in the lives of students. So we're really appreciative of the effort that went into today. So thank you.
Thank you, Perlene and Maria. You always see where the gaps are, and that's where you bring all these wonderful people in and to make that information accessible to the students. So thanks, this is excellent.
Well, and I was going to say, Maheen, it's really important that everybody knows about OCC, because this is a great way of people making connections as well to the work that OCC, the Ontario College Councillors, are doing is great. So thanks for being here, both as you and as your OCC hat.
Thank you for inviting me.
All right, and with that, everyone have a wonderful rest of the day, and we'll continue working together on the information sheet.
All right.
Take care.
Great. Thanks everyone for all your hard work.
Thank you.
Bye.
Thank you.
Bye.
Bye, everyone.